Hi everyone, I'm Jen Broyles. I'm here with Betty Murray of Living Well Dallas, and we are so excited to share with you a brand new service that we have at Living Well. And you know, so many people are actually affected with a very common sleep disorder known as sleep apnea, and we now have a fantastic at-home sleep study test that you're able to take out of the comfort of your own home to really determine whether sleep apnea is affecting you and how we can work together to go about and treat it. And I'm going to kind of turn it over to Betty and let her share her story with the sleep test and really what it's, you know, very, very effective in treating and improving.
Absolutely. So what's interesting is sleep apnea, or obstructive sleep apnea, is a condition where you have obstructions in the throat that happen while you're sleeping. Sometimes it can be caused by additional weight. As we gain weight, you have more pressure on the neck because there's weight around the neck that wasn't there previously. But other things can contribute to it as well, where you wake up frequently throughout the night, which causes you to have interrupted sleep. You also don't get into the more restorative sleep stages where your body actually does rest and repair. The really scary part about it is 1 in 10 people that have sleep apnea are being talked about it with their doctors. So you may have the problem, the doctor's not even asking, but the more serious situation is sleep apnea kills you faster than smoking. It has an earlier death rate. You have 8 years shaved off your life if you have sleep apnea. So it's very concerning. And from our standpoint, when we're working with people, particularly with weight loss or diabetes or heart disease risk, sleep is often an issue. You know, so one of our first questions is, do you snore? And do you snore a lot? Do you wake up gasping for air? Or does your spouse or significant other say, hey, I don't want to sleep in the same room with you anymore? So it's concerning. So a lot of patients that get recommended to go to a sleep study, to a sleep clinic, it feels kind of cold and sterile because you're in a bedroom that's kind of like a scaled down hospital or a scaled down hotel room with somebody sitting on a two-way glass mirror, and you've got all these wires hooked up to you and you're supposed to go to sleep and have a normal night. So the sleep study at home has been recently approved by most of your major insurance companies, Blue Cross Blue Shield, United, Aetna, and Cigna, and allows you to go home and do that test in your own bed, with your own clothes, your own blankets, pillows, all of that, and also doing the exact same things. Because we always recommend people do the exact same behavioral things they do at night. So if you go home and have 2 glasses of wine after the kids are in bed, you need to do that because that affects your sleep and can actually make sleep apnea worse. And the even more impressive thing is we do 2 nights because we want to make sure we have good data, and it costs considerably less than it would if you went to a sleep clinic. And so that can be very, very beneficial too for patients because you're not going to have as much out of pocket as you might if you went to a clinic.
Yeah, so incorporating this service into all of our many services that we offer has proven very effective, simply because sleep apnea can prevent so many other things that you may want to happen in your life. Maybe you're really wanting to lose weight, but you know, not knowing that you have sleep apnea, that may be preventing you from effective weight loss. And so, you know, if you think that sleep apnea or a sleep disorder may be affecting you, give us a call and, you know, come in. We'll talk it over in a consultation and see if this test may be appropriate for you. So you can reach us at 972-930-0260. We look forward to working with you.